Mental illness and substance use disorders are pressing concerns impacting millions worldwide. These conditions don't discriminate, affecting individuals of all ages, backgrounds, and walks of life. The World Health Organization estimates that nearly 2/3 of people with a known mental disorder never seek help from a health professional at all, highlighting a crucial gap in awareness and access to care. The impact of these disorders extends far beyond the individual, affecting families, communities, and society as a whole. The stigma surrounding mental illness and substance use often prevents individuals from seeking the help they desperately need. This silence can have devastating consequences, leading to isolation, worsening symptoms, and even tragic outcomes. It is imperative that we break down the barriers of stigma and create a culture of empathy and understanding where individuals feel safe to come forward and seek support. Effective treatment and recovery strategies are essential in addressing these complex challenges. By understanding the underlying causes, symptoms, and available treatments, we can empower individuals to reclaim their lives and live to their fullest potential. Healthcare professionals play a critical role in supporting recovery, providing compassionate care, evidence-based interventions, and hope for a brighter future. Understanding the principles of treatment and recovery is paramount to providing effective care. This requires a shift from a solely symptom-focused approach to a more holistic perspective, addressing the individual's physical, emotional, social, and spiritual well-being. Integrated care models that address co-occurring disorders, such as mental illness and substance use, are crucial in providing comprehensive support. Patient outcomes are significantly enhanced through comprehensive care that extends beyond addressing immediate symptoms. This includes providing education, skills training, and ongoing support to help individuals manage their conditions, prevent relapse, and build a life worth living. Access to resources such as peer support groups, community-based programs, and affordable healthcare is essential in fostering long-term recovery. Reducing stigma is not only a matter of compassion, but also a critical component of effective treatment and recovery. When individuals feel stigmatized, they are less likely to seek help, disclose their conditions, or adhere to treatment plans. Creating a society that embraces mental health awareness, promotes open dialogue, and challenges discriminatory attitudes is essential. By working collaboratively, healthcare professionals, policymakers, individuals with lived experience, and communities can create a more supportive and understanding environment. Through education, advocacy, and compassionate care, we can empower individuals to overcome the challenges of mental illness and substance use disorders and live healthier, more fulfilling lives. Depression, a prevalent mental illness, casts a long shadow over the lives of millions. It is more than just feeling sad or down. It is a complex disorder characterized by persistent sadness, loss of interest in once enjoyable activities, and a pervasive sense of hopelessness. The weight of depression can manifest physically as well, leading to changes in appetite, sleep disturbances, fatigue, and difficulty concentrating. Daily tasks that once seemed manageable can feel insurmountable, leaving individuals feeling overwhelmed and defeated. Cognitive behavioral therapy, or CBT, is a common and effective treatment for depression. CBT helps individuals identify and modify negative thought patterns and behaviors that contribute to their depression. Antidepressant medications, prescribed by healthcare professionals, can also help alleviate symptoms by regulating brain chemicals associated with mood. Lifestyle changes, including regular exercise, a healthy diet, and sufficient sleep, are essential components of a comprehensive treatment plan. It is important to remember that depression is a treatable condition, not a sign of weakness. With appropriate treatment and support, individuals can experience relief from their symptoms and regain control of their lives. Creating a supportive environment for individuals with depression is crucial. Family and friends can play a vital role by offering empathy, understanding, and encouragement. Anxiety disorders encompass a range of conditions characterized by excessive worry, fear, and unease. From generalized anxiety disorder, where worry permeates daily life, to panic disorder, marked by sudden and intense episodes of fear. Anxiety disorders can significantly impact an individual's well-being and daily functioning. Physical symptoms, including a racing heart, shortness of breath, dizziness, and muscle tension, often accompany anxiety, further exacerbating distress. Cognitive behavioral therapy, or CBT, is a cornerstone of anxiety disorder treatment. CBT equips individuals with coping mechanisms to manage anxious thoughts and behaviors. Therapists work collaboratively with individuals to challenge negative thought patterns, develop relaxation techniques, and gradually confront anxiety-provoking situations. Medications, such as anti-anxiety medications, may be prescribed to help manage symptoms, particularly in the short term. Lifestyle modifications can also play a significant role in managing anxiety. Engaging in regular physical activity, practicing mindfulness techniques like meditation and deep breathing, and prioritizing sleep can help regulate mood and reduce anxiety levels. Creating a calm and structured environment can also be beneficial. Section 3. The spectrum of bipolar disorder. Bipolar disorder, previously known as manic depression, is a complex mental illness characterized by dramatic shifts in mood, energy, and activity levels. Individuals with bipolar disorder experience periods of intense highs, known as mania or hypomania, alternating with periods of deep lows, known as depression. These mood swings can vary in severity and duration, significantly impacting an individual's relationships, work, and overall quality of life. Treatment for bipolar disorder typically involves a combination of medication and therapy. Mood stabilizers, such as lithium, are often prescribed to help regulate mood swings and prevent both manic and depressive episodes. Psychotherapy, including cognitive behavioral therapy, or CBT, and interpersonal and social rhythm therapy, or IPSRT, can help individuals develop coping mechanisms, manage stress, and establish healthy routines. Living with bipolar disorder can be challenging, but with proper treatment, support, and self-care, individuals can lead fulfilling lives. It is crucial for individuals with bipolar disorder to have a strong support system in place, including understanding family and friends, mental health professionals, and support groups. Education about the condition is essential for both individuals with bipolar disorder and their loved ones to foster understanding and reduce stigma. Alcohol use disorder, commonly known as alcoholism, is a chronic, relapsing disease characterized by an inability to control alcohol consumption despite negative consequences. It affects individuals of all ages, backgrounds, and walks of life, often leading to a downward spiral of physical, emotional, and social problems. The grip of alcohol addiction can be incredibly powerful, making it challenging for individuals to stop drinking on their own. One of the hallmarks of alcohol use disorder is the development of tolerance, where individuals need to drink increasing amounts of alcohol to achieve the desired effect. This tolerance can lead to dependence, meaning the body and brain have adapted to the presence of alcohol and experience withdrawal symptoms when alcohol consumption is reduced or stopped. Withdrawal symptoms can range from mild anxiety and tremors to severe complications like seizures and delirium tremens, highlighting the importance of medical supervision during detoxification. Treatment for alcohol use disorder typically involves a multifaceted approach tailored to the individual's needs. Detoxification, often conducted in a hospital or residential setting, helps manage withdrawal symptoms and provides medical stabilization. Cognitive behavioral therapy, or CBT, is a widely used therapeutic approach that helps individuals identify and modify thoughts, feelings, and behaviors that contribute to alcohol use. Support groups like Alcoholics Anonymous, or AA, offer a supportive community and a structured program for recovery. Opioid use disorder, fueled by the overprescription of painkillers and the rise of potent synthetic opioids like fentanyl, has ravaged communities across the globe. Opioids, while effective in managing pain, are highly addictive substances that can hijack the brain's reward system, leading to compulsive drug seeking and use. The consequences of opioid addiction are dire, including overdose, infectious diseases like HIV and hepatitis C, and profound social and economic hardship. Individuals struggling with opioid use disorder often experience intense cravings, withdrawal symptoms, and an inability to control their drug use. The fear of withdrawal, characterized by symptoms such as nausea, vomiting, muscle aches, and intense anxiety, can be a significant barrier to seeking help. The stigma surrounding opioid addiction further isolates individuals, preventing them from accessing the care they need. Medication-assisted treatment, or MAT, using medications like methadone, buprenorphine, and naltrexone, is the gold standard for treating opioid use disorder. These medications help reduce cravings, manage withdrawal symptoms, and block the euphoric effects of opioids, allowing individuals to engage in therapy and rebuild their lives. Counseling, both individual and group, is an essential component of treatment, providing support, coping skills, and relapse prevention strategies. Stimulant use disorder, involving drugs like cocaine, methamphetamine, and prescription stimulants, is a growing public health concern. Stimulants act by increasing dopamine levels in the brain, leading to feelings of euphoria, increased energy, and alertness. However, prolonged stimulant use can have serious physical and psychological consequences, including cardiovascular problems, paranoia, psychosis, and addiction. The allure of stimulants often lies in their ability to enhance performance, suppress appetite, and induce feelings of confidence and well-being. However, tolerance develops rapidly, leading individuals to consume higher doses or use more frequently to achieve the desired effect. This pattern of escalating use can quickly spiral into addiction, characterized by cravings, withdrawal symptoms, and an inability to control use, despite negative consequences. Treatment for stimulant use disorder typically involves a combination of behavioral therapies and support groups. Cognitive behavioral therapy, or CBT, helps individuals identify and modify thoughts, feelings, and behaviors that contribute to drug use, Contingency management, using incentives and rewards for positive behaviors, can be effective in promoting abstinence. Support groups, such as Cocaine Anonymous and Narcotics Anonymous, provide a peer support network and a structured program for recovery. Recovery from mental illness and substance use disorders is not merely the absence of symptoms. It is a journey of healing and transformation that encompasses all aspects of an individual's life. A holistic approach to recovery recognizes the interconnectedness of the mind, body, and spirit, addressing the individual's physical health, emotional well-being, social connectedness, and spiritual needs. This multifaceted approach acknowledges that true healing requires more than just treating symptoms. It requires nurturing the whole person. Physical health is paramount in recovery, as mental and physical health are inextricably linked. Addressing underlying medical conditions, promoting healthy lifestyle choices, and encouraging regular physical activity are essential components of a holistic approach. Proper nutrition, adequate sleep, and stress management techniques are crucial in supporting both physical and mental well-being. Emotional and psychological well-being form the cornerstone of recovery. Providing access to therapy, counseling, and support groups creates a safe and supportive space for individuals to process trauma, develop coping mechanisms, and build resilience. Addressing past traumas, unhealthy thought patterns, and emotional regulation difficulties is essential in fostering lasting recovery. Social connections and support systems play a vital role in the recovery journey. Encouraging individuals to rebuild healthy relationships, connect with supportive peers, and engage in meaningful activities helps combat isolation, fosters a sense of belonging, and provides a network of support during challenging times. Community-based programs, peer support groups, and social activities can be invaluable resources in promoting social reintegration and reducing stigma. Person-centered care represents a paradigm shift in mental health and substance use disorder treatment, placing the individual at the center of their own recovery journey. This approach recognizes that each person's experiences, needs, and preferences are unique, and treatment plans should be tailored accordingly. Empowering individuals to actively participate in their care, make informed decisions, and set their own recovery goals is fundamental to person-centered care. Creating individualized treatment plans based on a thorough assessment of the individual's strengths, challenges, values, and goals is essential. This collaborative process ensures that the individual's voice is heard, their preferences are respected, and their treatment plan aligns with their unique circumstances and aspirations. Regularly reviewing and adjusting the treatment plan in partnership with the individual ensures that it remains relevant and responsive to their evolving needs. Empowerment is a cornerstone of person-centered care, encouraging individuals to take ownership of their recovery journey and develop the skills and confidence to manage their condition independently. This involves providing education about their diagnosis, treatment options, and self-care strategies, as well as supporting them in developing self-advocacy skills to navigate the healthcare system and access resources effectively. Peer support, a powerful component of person-centered care, harnesses the lived experiences of individuals in recovery to provide hope, encouragement, and practical guidance to others facing similar challenges. Peer support specialists, having walked the path of recovery themselves, offer a unique understanding, empathy, and credibility that can be invaluable in inspiring hope and facilitating connection. Recovery from mental illness and substance use disorders is an ongoing process that requires commitment, support, and a toolbox of effective strategies. Therapeutic interventions, grounded in evidence-based practices, play a crucial role in equipping individuals with the skills and insights needed to manage their conditions, modify unhealthy behaviors, and build a life worth living. These interventions are not one-size-fits-all. Rather, they are tailored to the individual's unique needs, preferences, and recovery goals. Cognitive behavioral therapy, or CBT, stands as a cornerstone of mental health and substance use disorder treatment, helping individuals identify and modify negative thought patterns and behaviors that contribute to their challenges. CBT empowers individuals to challenge distorted thinking, develop healthier coping mechanisms, and gradually confront anxiety-provoking situations. By recognizing the link between thoughts, feelings, and behaviors, individuals can interrupt negative cycles and make positive changes. Motivational interviewing, or MI, another valuable therapeutic approach, focuses on enhancing an individual's intrinsic motivation to change. MI recognizes that change is often a process, not an event, and individuals may cycle through stages of readiness to change. Through empathetic listening, open-ended questions, and affirmations, therapists using MI help individuals explore their ambivalence, clarify their values, and build their own motivation for change. Family therapy plays a crucial role in supporting recovery, recognizing that mental illness and substance use disorders impact not only the individual, but also their family system. Family therapy provides a safe and structured environment for family members to communicate openly, address conflicts, and develop healthier communication patterns. By involving loved ones in the treatment process, family therapy strengthens support systems, repairs strained relationships, and promotes healing for all involved. Medication-assisted treatment, or MAT, has emerged as a critical component of opioid use disorder treatment, utilizing medications like methadone, buprenorphine, and naltrexone to manage cravings, reduce withdrawal symptoms, and prevent relapse. MAT is most effective when combined with counseling and behavioral therapies, addressing both the physical and psychological aspects of addiction. By reducing cravings and withdrawal symptoms, MAT allows individuals to engage more fully in therapy and focus on rebuilding their lives. Support groups such as Alcoholics Anonymous, Narcotics Anonymous, and Smart Recovery offer a lifeline of peer support to individuals in recovery. These groups provide a safe and non-judgmental space for individuals to share their experiences, receive encouragement, and learn from others who have faced similar challenges. The power of peer support lies in the shared understanding, empathy, and hope that individuals find in connecting with others who truly understand their struggles. Relapse prevention is an ongoing process that requires individuals to develop a personalized plan to identify and manage triggers, cope with cravings, and maintain their recovery. This may involve identifying high-risk situations, developing coping mechanisms for stress and negative emotions, and building a strong support network. Relapse is not a sign of failure, but rather an opportunity to learn, adjust, and strengthen one's recovery plan. Integrated treatment, recognizing the prevalence of co-occurring mental health and substance use disorders, emphasizes a coordinated and comprehensive approach to care. John, a 35-year-old accountant, found himself trapped in a vicious cycle of depression and alcohol use disorder. The demands of his job, coupled with a history of unresolved grief and a family history of alcoholism, had led him down a dark path. He experienced persistent feelings of sadness, hopelessness, and a lack of interest in activities he once enjoyed. To numb the emotional pain, John turned to alcohol, which quickly escalated from social drinking to heavy use, consuming several drinks most evenings to cope with his inner turmoil. As John's alcohol consumption increased, so did its negative consequences. He struggled to concentrate at work, leading to missed deadlines and strained relationships with colleagues. His sleep was disrupted, leaving him feeling exhausted and irritable. His physical health also deteriorated, with frequent headaches, stomach problems, and weight gain. Despite knowing that alcohol was exacerbating his problems, John felt powerless to stop, trapped in the throes of addiction. Concerned about his well-being, John's brother encouraged him to seek professional help. With his brother's support and a glimmer of hope for a better life, John took the courageous step of contacting a therapist specializing in addiction and mood disorders. The therapist conducted a thorough assessment, diagnosing John with major depressive disorder and alcohol use disorder. Recognizing the interconnectedness of John's conditions, the therapist recommended an integrated treatment approach. John's treatment plan included individual cognitive behavioral therapy, or CBT, to address his negative thought patterns and develop healthier coping mechanisms for stress and difficult emotions. The therapist helped John identify his triggers for alcohol use, challenge his negative self-talk, and develop strategies for managing cravings. To address his alcohol dependence, John was prescribed medication-assisted treatment, or MAT, with naltrexone, which reduces alcohol cravings and blocks the pleasurable effects of alcohol, making it easier to abstain from drinking. Section 2. Sarah's Triumph: Managing Bipolar and Opioid Use Disorders. Sarah, a vibrant 28-year-old artist, had always struggled with her emotions, experiencing periods of intense creativity and energy, followed by crushing lows of depression and fatigue. Diagnosed with bipolar disorder in her early 20s, Sarah found some relief with medication and therapy, but the stigma surrounding her condition and the challenges of managing her mood swings led her to self-medicate with opioids. What began as occasional use of prescription painkillers quickly escalated into a full-blown opioid addiction. The opioids provided temporary relief from her emotional pain and mood swings, but at a steep price. Sarah's life became increasingly chaotic, her art took a backseat to her addiction, and her relationships suffered as she isolated herself to hide her drug use. The shame and guilt she felt were overwhelming, further fueling her addiction and deepening her despair. Desperate for a way out, Sarah confided in her therapist, who had been treating her for bipolar disorder. Recognizing the severity of Sarah's situation, the therapist recommended an integrated treatment approach that addressed both her mental health and substance use disorders. Sarah was referred to an addiction specialist, and together they developed a comprehensive treatment plan tailored to her needs. Sarah's treatment plan included a combination of medication management, individual therapy, and support group participation. Her psychiatrist adjusted her mood stabilizer medication to better manage her bipolar symptoms, while also prescribing buprenorphine, a medication-assisted treatment for opioid use disorder. Buprenorphine reduces cravings and withdrawal symptoms, allowing Sarah to focus on her recovery without the grip of addiction. Section 1. The Shadow of Stigma. Despite the prevalence of mental illness and substance use disorders, a pervasive stigma continues to cast a long shadow on those who struggle with these conditions. This stigma, often rooted in misunderstanding, fear, and prejudice, creates a culture of silence and shame that prevents individuals from seeking the help they need. The consequences of stigma are far-reaching, impacting individuals' self-esteem, relationships, employment opportunities, and overall quality of life. The internalization of stigma, where individuals absorb negative societal attitudes and beliefs, can be particularly damaging. Individuals may hesitate to disclose their conditions to loved ones, fearing judgment, rejection, or discrimination. This fear of stigma can prevent individuals from seeking professional help, leading to worsening symptoms, social isolation, and a diminished sense of self-worth. Addressing stigma requires a multifaceted approach that involves education, awareness campaigns, and open dialogue. Challenging misconceptions and stereotypes about mental illness and substance use disorders is crucial in fostering empathy, understanding, and acceptance. Sharing personal stories of recovery can be particularly powerful in humanizing these conditions and demonstrating that recovery is possible. Healthcare professionals have a responsibility to provide compassionate, non-judgmental care that respects the dignity of all individuals seeking help. By creating a safe and welcoming environment, healthcare providers can encourage open communication, reduce shame, and empower individuals to actively participate in their own recovery. While significant strides have been made in recent years, access to quality mental health and substance use disorder treatment remains a significant challenge for many individuals. Barriers to access, including financial constraints, lack of insurance coverage, limited availability of specialized providers, and geographical disparities can prevent individuals from receiving the timely and comprehensive care they need. Financial barriers, such as high treatment costs, copays, and deductibles, can be insurmountable for individuals and families already struggling with the economic burden of these conditions. Lack of insurance coverage or inadequate mental health benefits further exacerbate these challenges, limiting access to essential services. Expanding access to affordable quality healthcare is crucial in ensuring that individuals receive the care they need without experiencing financial hardship. The availability of specialized providers, particularly in rural and underserved areas, is often limited, leading to long wait times for appointments and limited access to specialized services. Addressing workforce shortages in mental health and substance use disorder treatment is essential in ensuring timely access to care. Telehealth, utilizing technology to deliver remote care, has emerged as a promising solution to bridge geographical barriers and increase access to specialized providers. The journey of recovery from mental illness and substance use disorders is often a marathon, not a sprint, requiring ongoing support to maintain progress and navigate challenges. However, access to long-term support services, such as peer support groups, sober living environments, and relapse prevention programs, is often fragmented and inadequate, leaving individuals vulnerable to relapse and setbacks. Investing in a continuum of care that provides ongoing support beyond the initial phase of treatment is essential in promoting lasting recovery. Recognizing the signs of mental illness and substance use disorders early and intervening promptly is crucial in improving outcomes and mitigating the potential for long-term consequences. Early intervention involves identifying individuals who may be at risk or in the early stages of these conditions, and providing timely access to appropriate assessments, interventions, and support services. By intervening early, we can prevent symptoms from escalating, reduce the severity and duration of illness, and improve the likelihood of successful recovery. Screening and assessment tools, administered by healthcare professionals, play a vital role in early detection. These tools are designed to identify individuals who may benefit from further evaluation and potential intervention. Routine screenings for mental health and substance use disorders in primary care settings, schools, and community centers can help reach individuals who may not otherwise seek help. Early intervention programs, tailored to specific populations and age groups, have shown promise in addressing risk factors and promoting mental health. For example, school-based programs that teach coping skills, stress management techniques, and substance use prevention strategies can equip young people with the tools they need to make healthy choices and navigate challenges effectively. The benefits of early intervention extend far beyond the individual, impacting families, communities, and society as a whole. By addressing these conditions early, we can reduce the economic burden associated with healthcare costs, lost productivity, and social services. Furthermore, early intervention can help break the cycle of stigma and create a culture of support and understanding. Family involvement is an invaluable asset in the treatment and recovery process, providing individuals with a vital source of love, support, and encouragement. Family members can play a crucial role in recognizing early warning signs, encouraging loved ones to seek help, and providing ongoing support throughout the recovery journey. Family therapy, involving members of the individual's immediate family or support system, can be particularly beneficial in addressing communication patterns, resolving conflicts, and strengthening family bonds. This type of therapy provides a safe and structured environment for family members to express their concerns, learn about the individual's condition, and develop strategies for supporting their loved one's recovery. Cultural competence in treatment and recovery is paramount in ensuring that services are responsive to the unique needs and perspectives of diverse individuals and communities. Culture shapes beliefs, values, attitudes, and behaviors, influencing how individuals perceive mental illness, seek help, and respond to treatment. Training healthcare providers in cultural competence involves developing an understanding of different cultural backgrounds, traditions, and beliefs, as well as recognizing the impact of cultural factors on health and well-being. Culturally competent care respects individual differences, avoids stereotypes, and tailors treatment approaches to align with the individual's cultural values and preferences. Understanding mental illness and substance use disorders is not merely an academic exercise. It is a call to action, a commitment to creating a world where individuals struggling with these conditions are met with compassion, understanding, and access to the support they deserve. It is about recognizing the humanity in each individual, regardless of their diagnosis, and fostering a culture of hope that empowers individuals to reclaim their lives and live to their fullest potential. Throughout this exploration, we have delved into the complexities of mental illness and substance use disorders, examining their prevalence, impact, and the principles of effective treatment and recovery. We have learned that these conditions know no boundaries, affecting individuals of all ages, backgrounds, and walks of life. We have also learned that recovery is possible, that with the right support, individuals can overcome these challenges and live full, meaningful lives. The journey of recovery is rarely linear. It is often marked by both triumphs and setbacks. However, by embracing a holistic approach that addresses the individual's physical, emotional, social, and spiritual well-being, we can create a foundation for lasting change. Person-centered care, empowerment, peer support, and ongoing access to resources are all crucial components of this journey. As we move forward, let us commit to challenging stigma, advocating for increased access to care, and supporting research efforts aimed at improving treatments and finding cures. Let us be beacons of hope, reminding those who are struggling that they are not alone, that recovery is possible, and that a brighter future awaits.